This presentation aims to highlight the unrecognized significance of chronic hidden hyperventilation as a major factor in modern diseases in the West, and to explain the underlying philosophy and medical thinking that has led to this serious omission. It will outline the basic physiology associated with chronic hidden hyperventilation, explain how this disturbed physiology can lay the foundation for, or even be the major cause of many modern diseases. It will introduce the remedial training that the Buteyko Method uses to correct chronic hidden hyperventilation, and give some basic advice on how to measure your own breathing and how you can begin to improve it with a few simple self-help exercises. When a health problem affects ever-increasing numbers of people, does not respond well to medical treatment, and is responsible for an ever-increasing number of deaths, might this not reasonably be termed an epidemic? Hyperventilation is almost invariably associated with all these conditions affecting over half the UK population, yet it is still usually undiagnosed, and even when it is diagnosed, rarely is the patient offered help to correct it, but is given medication to suppress or ameliorate the symptoms that may be largely due to the hyperventilation. With the almost limitless adverse consequences of hyperventilation on our health, one would expect this problem to be of prime interest to all doctors. But only 2 doctors have made a significant contribution to establishing chronic hidden hyperventilation on the modern medical agenda. Professor Konstantin Pavlovich Buteyko, who was born in the Ukraine in 1923, devoted his entire life to researching the effects of dysfunctional breathing, and Dr. Claude Lum, emeritus consultant physician at Papworth Hospital, was regarded as the leading UK expert on hyperventilation. Let's start with a simple question. Why do we breathe? We were told at school it's to get oxygen into our lungs and get rid of waste gases. The bigger our breaths, the better our health. Later we were told if stressed we should take a big breath. If we went to a gym or keep fit class, we would be taught to do deep breathing. Well, we were told wrong. One aim of this presentation is to correct those errors, to reverse the significance of oxygen and carbon dioxide. Carbon dioxide, far from being a waste gas, is the very basis of life as we know it, from the single cell to the giant redwood. There is no living thing that can survive without it. Professor Buteyko described carbon dioxide as the hormone par excellence because of its impact on every biochemical reaction in the body. The elevated status of oxygen over carbon dioxide began in the 18th century when oxygen and phlogiston, what we now call carbon dioxide, were discovered. A mouse put in a jar of phlogiston soon died, but the mouse put in a jar of oxygen remained active and survived the ordeal with no ill effects. From this time onwards, even to today, oxygen has been seen as the good, life-preserving gas, and carbon dioxide the evil, lethal gas. Only in recent years has the potential serious harm of administering pure oxygen and the value of carbon dioxide in reviving patients under anaesthetic have been recognised. We might discover the beginnings of this carbon dioxide problem in the earliest life on Earth. If we return to an Earth of 300 million years plus ago, the atmosphere was over 6% carbon dioxide, combined with oxygen and nitrogen. Every living thing, trees, simple sea crustacea, and early land creatures thrived and grew at an enormous rate. They soon removed most of the carbon dioxide in the atmosphere, leaving it as coal, oil and chalk deposits. The carbon dioxide level fell to roughly as it is today, 0.3%, almost nil. What had been a perfect environment for life became almost an alien planet for many creatures. Living things had to adapt to the minute amount of carbon dioxide now found in the atmosphere, 3 parts in 10,000 parts of air. Early mammals dealt with this problem by maintaining the 6% carbon dioxide within themselves. Their lungs became reservoirs of carbon dioxide, just as we need tanks of oxygen to survive on the moon. Humans still need 6% carbon dioxide in their bodies. Our lungs have effectively become carbon dioxide tanks that have allowed us to survive on what has now become almost an alien planet. Since we produce far more carbon dioxide than we need to maintain life, the process of breathing is governed primarily by the carbon dioxide levels in our body, so as to maintain the ideal 6%. If it rises high, we breathe more to wash out the excess. If it goes too low, we breathe less to conserve it. It is indeed a useful image to hold in one's mind to see the lungs as tanks of carbon dioxide that need to be kept at just the right level. There's always an adequate oxygen supply while we breathe, as 20% of the air we inhale is oxygen, and 16% of the air we breathe out is oxygen. We live in a sea of oxygen. Receptors in the brain measure the level of carbon dioxide in the blood and adjust our breathing accordingly. If too high, our breathing increases. If too low, our breathing is slowed down. This system works automatically and perfectly until it goes wrong. So why did it go wrong? Just a little more history, back 50,000 years to our ancestors, who were not hunters so much as the prey in a hostile land. Their survival demanded an ability to react instantly to dangers, to fight with or flee from the predators. We have survived to today because of the development of our fight or flight response to danger. The fight or flight response causes major physiological changes in our bodies to prepare us for fighting or running. The fight-flight response is an automatic response to stressors. The heart beats faster, our breathing increases, blood goes to the muscles, sweating increases, blood clotting increases, muscles tense preparing for action. This was life-saving to early man hunted by many predators. Today this automatic system is still there, but with our sedentary lifestyle, with very few saber-toothed tigers, it's not so useful. However, any trigger, emotional, stress, exercise, allergen, injury, infections or odd food can give our body the same response of fast heartbeat, fast breathing, but we rarely leap into physical activity to discharge this energy. These repeated stress responses of increased breathing, preparing us for increased physical activity, cause lowered carbon dioxide levels that would, in the past, be soon replenished as heavy physical exercise began. But for modern man, this rarely happens, and as there is no increased physical activity, the carbon dioxide levels are repeatedly depressed. With repeated stresses, carbon dioxide levels fall. The receptors in the brain begin to accept this lowered level as normal. We are now locked into chronic hidden hyperventilation, as our body adjusts our breathing to maintain this lower carbon dioxide level, with a breathing rate higher than normal. Chronic hidden hyperventilation cannot easily be observed by others, and perhaps this is why it has not been diagnosed more frequently. It takes only small increases in breathing rate, small increases in volume per breath, and occasional sighs or yawns, all to add together to triple the volume of air we breathe per minute. When the carbon dioxide levels fall in the body, major physiological changes take place instantly, lead to all the body's functioning being severely disturbed. 3 key effects are seen. First, the blood holds onto its oxygen more tightly, not releasing it to the body's tissue efficiently. Second, smooth muscle goes into spasm throughout the body, where it's wrapped around blood vessels, airways and other hollow organs. And the chemistry of the entire body is disturbed as the acidity-alkalinity shifts the pH towards respiratory alkalosis. The brain scan shows the effect on a healthy person breathing normally at first, then breathing heavily for just 1 minute. Red areas show high oxygen delivery, dark blue low oxygen delivery. The effect on us is made worse as the little oxygen there is shunted to lower centres of the brain to keep vital organs working, causing poor oxygen supply to the higher centres. Our ability to even think is seriously impaired. This effect is due to the impaired release of oxygen from the blood as well as the constriction of blood vessels supplying the brain. All tubes in the body and hollow organs are surrounded by smooth muscle that twitch and spasm when carbon dioxide levels fall, causing amongst other things narrowing of airways, spasm of the gut, tightening of the bladder and narrowing of blood vessels. As carbon dioxide levels fall, the acid alkalinity of the blood is changed. The body begins to move towards respiratory alkalosis. This impairs every chemical reaction in the body, the emphasis being on every chemical reaction, notably hormone production, amino acid production, insulin production, thyroid function, calcium and cell energy metabolism. The consequence of these changes to deranged body functioning is impaired health and the foundation for illness. Almost every disease is associated with some degree of chronic hyperventilation, particularly these shown here. It seems paradoxical that conditions like asthma that involve breathlessness should demand the person reduce their breathing, but this schematic graph gives a simple visual explanation. It is because oxygenation of the tissue is the real reason for our breathing and not moving quantities of air in and out of the lungs. And it is the poor tissue oxygenation which gives us the sensation of breathlessness. With no air breathed, there is no tissue oxygenation, and as we increase our breathing towards about 5 litres per minute, oxygenation of our tissue increases. But beyond this rate of breathing, oxygenation begins to fall until at about 15 litres per minute, cells start to die because of oxygen shortage and respiratory alkalosis. All hyperventilation related conditions improve as the volume of air breathed per minute is reduced. The traditional medical wisdom is that triggers produce symptoms that include hyperventilation. Professor Buteyko emphasized the effect of the fight or flight response to triggers or stresses, and therefore argued that triggers produce hyperventilation among other responses, and that the hyperventilation leads to the symptoms suffered, that in turn worsen the effect of the triggers. Hence, the 3 solutions that could be applied would be: first, keep away from any triggers and in practice suggestion. Second, use drugs to suppress or palliate the symptoms, the current approach generally used. Or third, stop hyperventilating, the Buteyko solution to breaking the vicious circle. How can we identify abnormal breathing without clinical measurement? Some or all of the following signs may be observed: breathing through the mouth, sighing, sleep apnea, noisy breathing, breathing from upper chest, shallow, short, panting breaths, frequent deep breaths for no reason, taking a mouth breath before talking, excessive yawning, snoring in sleep, constant tiredness and low energy. Do you hyperventilate? Check your own breathing with the controlled pause. Professor Buteyko developed a simple method of measuring breathing rate that was adequate for monitoring and training purposes and could be used by the patient themselves. It is called the controlled pause and measures your maximum comfortable breath hold after a normal out-breath when resting. The control pause reflects your breathing rate or volume of air breathed per minute. To measure your control pause, sit quietly for a few minutes, keep your mouth closed and only breathe through your nose. Listen to your breathing, and at the end of an out-breath, just hold your nose gently. Hold your breath until you feel the need to breathe in again. Release your nose and breathe in. This breath hold should be comfortable and in no way stressful. It is your maximum comfortable breath hold. Note the number of seconds you held your breath with a timer or stopwatch. This is your control pause. The control pause should be between 45 and 60 seconds for normal breathing. 30 to 45 seconds suggests slight overbreathing. Between 20 and 30 seconds indicates moderate hyperventilation. 10 to 20 seconds high hyperventilation, probably breathing 3 times normal volume per minute, and under 10 seconds is severe hyperventilation. When checking your control pause, do not try to hold your breath longer than comfortable. to try to achieve a better result. It is a measuring tool. We don't stretch out tape measures to reduce our waistline measurement, so do not force a breath hold to get a better reading of your breathing. As has been discussed, hyperventilation has the effect of lowering the carbon dioxide levels in the lungs. Although the control pause gives a good approximation of the carbon dioxide levels in the alveoli of the lungs, a more precise and clinically recognized measure of this can be determined with a capnograph. The capnograph records end-tidal carbon dioxide whilst the patient breathes by sampling the exhaled air from the nose. This equipment may also be used as a training tool to help people improve their breathing by seeing their breathing pattern live on the computer screen using the Capno Trainer facility. There is no argument today that overbreathing makes us ill. Research projects have repeatedly demonstrated this. Just how significant hyperventilation is with regards to an individual and their health problems depends on how severe their hyperventilation is, their genetic makeup, their lifestyle, their environment, and many more factors. However, once we recognize we can improve our breathing and learn to take better control of hyperventilation, there can only be health benefits, usually reduced symptoms, improved energy, better sleep, and a calmer, more relaxed response to all the stresses in our lives. There are no adverse side effects. Anyone can learn how to do this, and once your breathing has been returned back to normal, it usually stays like that without any regular exercises. The only exception might be after a severe stress such as a car accident or bad emotional upheaval, when you might need to do some exercise to bring your breathing under control again. This graph, taken from 24 published medical studies, shows how our breathing rate has increased since 1929 to the level it is now. This graph is based on studies, medical studies, showing that asthmatics breathe 2 to 2.5 times more than normal. This graph, taken from medical references, shows how many heart patients breathe about 2.5 times more than normal. And once again, from medical references, this graph shows how diabetics breathe 2 to 2.5 times more than normal. The following two slides show some of the clinical studies which have been performed to show the effect of Buteyko training, particularly on asthma conditions, but also on other medical conditions. One of the main criticisms of the Buteyko method is that insufficient research has been done, but the problem arises here that one of the main effects of Buteyko training is reduced use of drugs and the need for drugs. And since the majority of medical research is funded by drug companies, this accounts for this slight dilemma. Some people may consider it not worth the little effort and time needed to improve their breathing, as their condition is well controlled with drugs. However, it must be pointed out that there are no medicines that do not have adverse side effects varying from minor discomfort to serious long-term impact on health. The recorded side effects as published by the British National Formulary give you some indication of the possible adverse effects of any medication you are taking. This does not mean improved breathing will allow you to eliminate your medication, but most people find better breathing along with other lifestyle changes as taught on the Buteyko course means they can safely reduce the need for drugs with the guidance from their doctor. As a rule, the less medication we can manage with, the better for our overall well-being. The Buteyko Method. The Buteyko Method consists of breathing techniques that are used to overcome the hidden hyperventilation that is so common in our lives today. It is not a medical treatment. It is an approach to correct the overbreathing problem and address other associated lifestyle problems. The person practices the breathing exercises that reset the carbon dioxide receptors in the brain to restore a normal breathing pattern. The person concentrates on breathing through the nose all the time until this becomes a normal habit. The person uses various strategies to overcome symptoms when exposed to triggers that increase breathing. Minor lifestyle changes are advised to help normalize breathing. The basic Buteyko techniques taught include nose clearing exercises, the controlled pause, taking the pulse, mini pause, anti-hyperventilation exercises, reduced breathing exercises, step exercises, extend pause, sealing the leaks, taping, and other advice on diet, posture and lifestyle. Nose clearing exercises 1 and 2. Exercise 1, with your mouth closed, breathe in gently through your nose, breathe out and hold your nose. Nod your head until you feel the need to breathe in. Release your nose and breathe in gently through your nose, taking care to keep your mouth shut. This exercise will clear most stuffy noses, but should the condition persist, try exercise 2. Exercise 2. With the mouth closed, breathe in and out gently through your nose. Hold your nose and keep walking until you feel the need to breathe in. Release your nose and breathe in gently through your nose, taking care to keep your mouth shut. And this second exercise deals with the most difficult and stubborn nasal conditions. Posture and general breathing advice. Try only to breathe with your diaphragm. Avoid upper chest breathing. Sleep on your side or stomach, not on your back. Keep a straight back. Avoid crushing the diaphragm. Pace yourself so you can nose breathe and avoid mouth breathing. Take short periods of relaxation every day to quieten your breathing. Avoid overeating or eating late at night. If your controlled pause is under 20 seconds, you'll be well advised to enroll in a full Buteyko course to improve your health for life. Learn to reduce your breathing. This is achieved largely through learning to relax fully while focusing on reducing your breathing. Avoid upper chest breathing. Only breathe through your nose. Take 15 minutes out twice a day to calm your breathing by doing the exercises described here. Record the date and time. Measure your controlled pause and pulse. Record these. This gives you a record of your breathing rate before you do any exercises. Sit quietly, relax as fully as you can, focusing on reducing your breathing through relaxation for 5 minutes. Check your controlled pause again and record it. Do another 5 minutes, reduce breathing, then wait 1 minute before checking your controlled pause and pulse again. This gives you a measure of your breathing rate after doing your exercises. If you're doing the reduced breathing correctly, you'll find your controlled pause has increased and your pulse may have slowed down. Finally, do you really want to improve your health? The Buteyko Method course could be the key. 5 sessions of 90 minutes over 2 to 3 weeks. 12 months telephone, email support. A structured, proven system of training. Guaranteed benefits for asthmatics. Once-in-a-lifetime training and investment in your health. Endorsed by the British Thoracic Society for the better management of asthma as an adjunctive therapy. For more details, visit www.buteykokent.co.uk or phone 0800 781 2534 or email for details of courses and talks at info@buteykokent.co.uk.